Now, to answer a very common and important question which almost everyone asks whenever we talk about urine therapy, isn't urine is waste? So, to find out that, the common and general understanding, and this is what we has been given to understand to us since childhood, and that you go into a steam bath cabin, that's how the steam which is excessive is taken out and used for various therapies. So the steam could be used. Similarly, the urine that is coming out from our body is not waste, that's why it is coming out, but it is because it is excessive that it comes out. The first thing which we need to understand is that urine is something which is extracted from our blood in the kidneys. So in our kidneys, there are one pair of kidney. One is on the right side, one is on the left side, almost of our size of a fist, small organ, but performs a very important function. And the functional unit of kidney would be, or the cells of kidney are called as nephrons. Nephrons are considered to be one of the most ultra filters. The procedure how the urine is formed, will not go now, but maybe in further classes when we will be talking about the urinary system, we shall go into it. But here, in a structure called as a nephron, there is a capsule-like structure, and there is a network of capillaries there. So blood comes in there, and this is where the exchange of molecules from the blood, and this is the urine forming tubule happens, and this is a molecular filtration. So first thing is that to us urine is produced from blood in kidneys and organs, the cells called nephron, and it is a kind of a ionic molecular diffusion. If you see the picture of blood, in our blood we have what is called as plasma and we call them as soluble and non-soluble ingredients. Plasma is the one which contains almost 91% of water, and it contains few proteins, whereas other non-soluble elements are the blood cells. So blood also has almost 91% of water and some important vital ingredients. If you see the composition of urine, you will also be amazed to know that another name in medical science for urine is called as plasma ultrafiltrate. This is in biology it is said urine is plasma ultrafiltrate. So kidneys filter the blood to produce urine to maintain body's balance of fluids, vitamins, electrolytes, amino acids, urea, and even antibodies. Now, in our body we have facility to store certain elements, and our body cannot store some of the elements. For example, our body can store fat, but can our body store water? Suppose if you have taken a glass of water, your body doesn't need a full glass of water. So where will that water go? Of course, as we ingest, whatever food we take, water we take, it goes into the digestive tract, it goes into the intestines. In the intestine it is absorbed. Where it goes? It gets into the blood. Blood goes from intestines to the various glands, from liver it goes to the heart, and again heart pumps the blood throughout the body to supply various nutrients to all the cells. Again that blood comes back to heart, again heart is pumping, it is getting oxygenated, but again the blood is going towards kidneys. So every time whenever the heart is pumping, almost 25% of the blood goes towards the kidneys. In kidneys what is happening is the ingredients which are excessive at that moment of time are removed from the blood. So the contents that are there in the urine are not waste, but they are excessive, that's why they are removed. For this, we need to understand a term called as a homeostasis. In physiology, we talk about homeostasis. Our body has a beautiful mechanism to maintain this, I would say, biochemical balance in our body. And for that, we have so many organs working towards that, even the skin, the various sweat glands, all of them, they are working to achieve what is called as a homeostasis. And the urine that we get is not waste, but it is excessive. That's why those products are there. Commonly, you might all agree with that urine, what is there? Suppose if you take a 10 ml of urine, you would find that the main content in the urine is the water, and then it has a very important minerals like sodium is there, potassium is there. Then people talk about the creatinine, uric acid and the urea, which are considered to be a little problematic. But with the experience, we have seen that the amount it is there in the urine is almost in a very negligible amount. It doesn't have any adverse effect. And if it is taken in even a larger quantity also, in a laboratory experiments they have seen, has no adverse effect. So to tell you, we have seen so far that urine, how urine therapy has been explained in traditional literature, how there are scientists who have tried to find out what are those ingredients that are found in urine which could be used for medicinal, and already medicines have been manufacturing. Somebody asked me, really you don't know from where these pharmaceutical companies extract the urine? I had one report from South Africa, from Durban, and to my surprise, it was said there that they even collect the urine from public urinals. And that urine was that was collected, used, and the elements which were extracted are used for food fortification. Like we use so many tinned, packed, processed tin food items which are considered to be fortified with certain vitamins and these things. They are all again extracted from the organic sources, and for that they use urine. Well, this is very difficult to digest and accept, I know. But we have a person from pharmacology, he is nodding his head, means yes, it is, it could be. Okay, I will present to you, I will not go into those scientific details. People who have still more queries, we can discuss one to one. Since I have to finish in time, I will present to you a few of the case studies. This man, you can see, when he came to us, had such a strong wound on his big wound there on his leg. Actually, he had in a road accident. His leg was smashed between the road and the silencer of his motorcycle, and that's how that burning and whole skin was scratched off. And despite of they did lot of therapy, what they did was the skin grafting. So they removed the skin from his thigh from here. You can see the patch there, and they tried to apply there. They did this surgery. Even then, the skin graft was not accepted body, and it got again infected, and the whole thing became more deteriorated thing. After doing a lot of work, they had to tell him that his leg needs to be removed. So amputation was suggested for him. And since he was crippled, and he was suffering from this problem for almost 6 months, this knee joint was almost stiff. He used to all the time hold his leg like this, and maybe the tendons and muscles, and even at the bony level, there was a kind of a calcification, and there was a lot of stiffness in the joint. He was not able to extend his leg. In this condition, he was a newly married person. His father wanted him in whatever way he wanted to get it repaired. They never wanted to lose the leg. And then out of that efforts, they came to us. Again, commonly he was on a lot of medication, antibiotics. He was on a very protein-rich diet. So in protein-rich diet, we always say for healing, any wound healing, one has to take a lot of protein rich diet. Actually, we kept him on a very simple sattvic food. We initially, in fact, we gave him 7 days of fasting, urine drinking, cleaning the wound with the urine and dressing it with the urine. And after almost about 45 days, we found that his wound was absolutely healed. Today, he is riding bicycle. This whole knee joint is absolutely flexible. He can move his leg. Such is the case. So this is the healing sequence of a non-healing ulcer using urine therapy. Another patient who had a diabetic wound, for whom they have tried so many medicines, but in diabetic wounds it's very difficult to heal, but urine therapy we could heal.
Both cases they were drinking?
They were applying as well as drinking, in both the cases. Here is another case of allergic eczema. This lady had allergic lesions on her scalp in such a way all of her scalp was full with lesions. A foul smelling discharge used to ooze out from the head. Even she had those lesions on her back, and all the time that was a very difficult situation for her to live a normal life. They did generally, as we know, for skin problems, most of the times dermatologist, if it is not working with any medicine, they use a blanket therapy, and that blanket therapy is steroids. So she was put on the steroids. She had taken a lot of steroids. Even then, this problem was persistent. What we observed when she came to us, we have our own way of history taking. We observed that she is of a pitta type. She has also a combination of vata. We observed that her digestion is absolutely upside down. She is constipated. She has a pitta. We put her on the fasting. We changed her diet. She was continuously drinking urine. The application of external urine was again with the fresh urine. We were doing the massages, and after 10 days of period, we saw these skin lesions were absolutely healed. So this is one more case which I wanted to show to you. This is another case. Sorry, I couldn't make it in English, but a case with the ulcerative colitis. This boy was almost of 30 kg weight. He had small ulcers in his large intestine, and that is called as ulcerative colitis, because of which he was passing loose motions mixed with mucus and blood. And as a result, since his digestion was totally affected, his body had become like a skeleton. He had lost a lot of weight, and he was again mentally so much depressed. He was treated. He was from Delhi. He was treated in AIIMS, All India Institute of Medical Sciences, one of the premier hospital in India, where a lot of research is also happening. And he was almost kept alive, feeding him intravenously, because orally whatever they would give, he will pass it out through the stools, and he will lose a lot of blood. He was brought to us. We did this urine therapy. Of course, it is a systematic process. I cannot explain to you what exact therapies we did, but overall it was a combination of yoga, naturopathic modalities, diet, and urine therapy all together. And after almost 3 months of period, we saw that his weight gain was there. And now this boy is still, this is a case about 10 years back when I had started my practice. This man is in my touch. Often he says that I freaked out, I ate this outside, today I had this non-vegetarian food and this, still I am healthy. That's how he communicates. So the thing which I want to share with you is that he had to follow a strict regimen only for some time, for some period of time. And later on, he could gain that health and that immunity towards this illness. Another lady with a similar problem, she was almost 24 kgs weight, and almost after, you can see, she was in a 8th month, and then in 10th month, that is about 2 to 3 months, we could see that there was a definite change in the weight. Ulcerative colitis. Here is another case of viral meningitis. Recently, a few years back, there was a there were floods in Bombay, and out of which there were many people who suffered from various types of unknown viral infections. This man suffered from, an old person suffered from viral meningitis, because of which he was not able to move. The moment he moves his neck, he would get the giddiness, he will fall down. He was totally bedridden, he was paralyzed. We started urine therapy. With the urine therapy, we could see that there was such an improvement that he could start even climbing the staircase. Here is another case of what is called as coronary artery disease. This man of age about 66 years, he was diagnosed of having blockage in the blood vessel. This is a picture of angiography. When a person has blockages in the heart, this is how the report looks like. This man had 60%, 99% on one side. He had almost 100%. Again, this was a very complicated case. He was told to go for bypass for this, and he was also asked for angioplasty to put the stents. As all of we know, whenever there are blockages in the heart, we have two types of therapies. One is angioplasty, wherein they put a stent, or they put a bypass, like they remove a blood vessel from the leg and they bypass that particular block by using another vessel. So that is how the surgeries are done. But recent research done by even modern medical science doctors by name Dean Ornish, a few of you might be knowing about him. Dean Ornish is a well-known cardiologist, and he first time proved that till now, actually this we did in 2004, but in 1990s Dean Ornish published his work, and he produced first results showing that if there is a blockage in the blood vessels, that can be reversed. Till then, the medical science assumed that once there is a blockage in the blood vessels, it cannot be reversed, and therefore the remedy is put a stent or make a bypass. That is the only remedy. But first time Dean Ornish in his research produced that these blockages could be reversed. So same life, so he labeled that program as a life modification program. In fact, it contains almost our yogic way of life, and same kind of a program we used, added with that urine therapy. And almost in a 1 year of time, we observed that these blockages were reduced remarkably after 15 months of time. Another case of ischemic heart disease. Here again, almost 70% of block. Here also 70% of block. He was asked for CABG, that is bypass surgery. And then again, after 1 year of time almost, we saw that. And again, he added to that, he had a problem of gout. You know, gout is a condition where in our body, the uric acid gets deposited in the joints, and joints get swollen. It would be very painful. And again, urine contains uric acid. And he was told that if you drink your urine, you are going to get your problem deteriorated. But interestingly, this man is absolutely recovered from gout as well as his coronary problem. Another lady with a similar problem. I'll just skip this slide. We have, this is the work that is published in Journal of Family Practice. How there was change in the arteries. You could see how there was change. And even why this slide is there is because the complicated blockages, like if the length of a block is longer, then it is a very difficult even for surgeries. So in that case also we have seen the blockages which are of longer size are also being treated. Interestingly, this lady had a blockage in her abdominal aorta. We have learnt about our circulatory system. From the heart, a main vessel that comes out is called as aorta. That goes downward and upward as well. The upward is called as ascending aorta. Downward, the one which goes is called as a descending aorta. This lady had atherosclerotic blockages in her downward going abdominal aorta. It is a main vessel that is going downward, and because of which she had severe problems with her lower part of the body. She had difficulty in digestion. She had lots of she had a severe pain in her legs, and that was established by doing what is called as a Doppler study, a color Doppler study, which shows us where are the blockages in those vessels. And the report said that she had blockages in her iliac, femoral, popliteal, anterior and posterior popliteal, tibial, dorsal spidis. These all arteries had reduced blood flow. Again, we gave her this integrated therapy, and we found that this here you can see the impression. The Doppler study of the both lower limb arteries is within normal limits. So we establish it with the investigation. This is another person who had avascular disease of the lower limb. He was a chronic smoker, and generally the people who have a addiction to the smoking, they often tend to get the blockages in the vessels. And this man had blockages in his lower vessels. His one greater toe was amputated because there was lack of blood flow, and that was getting gangrene. There was a gangrene actually, and they had to amputate this thing. Finally, the people said, doctors told him that if you are continuing with this wrong way of living, your whole leg needs to be amputated. He was brought to us. We changed his lifestyle. We counseled him. We stopped his smoking. We changed his lifestyle. We changed his diet. And along with that, we gave him urine therapy. And very interestingly, within a very less period of time, we saw that those vessels were almost clear. There are plenty of examples. Generally, at our setup, we use yoga, sunbathing, some of the naturopathic treatments, wherein those 5 elements are used, like the treatments with earth, that is mud therapy, acupressure, various types of therapies that are offered there. Here I want to share, these are again old case studies. Every day we gather lots of case studies, in fact, but this is an interesting case. This man was a driver in a public transport. All of a sudden, because of some tensions, he had a severe hemorrhage in the brain, and because of which he was paralyzed. He was almost bedridden. He was in modern medicine, there are only the medicines that are given to thin the blood, and so that the clot would not happen again and again. So that's how the maintenance drugs are given. After the modern medical treatment, whatever the emergency treatment was done, he was sent home, and he was asked to do physiotherapy and exercise therapy. He was asked to come to us. We started giving him therapy, and very interestingly, today this man has regained his ability. He's rehabilitated to such a way that he has again joined his job as driver. This is another lady who had problem of epilepsy. Somebody was asking me about epilepsy. With urine therapy, we have found very good results. She used to take epileptic medicines, anti-convulsion medicines. We are able to stop them. Somebody asked me who is Dr. Dean Ornish. These are the few scientists from modern medicine who have taken open approach towards yoga, lifestyle modification programs, yoga, naturopathy, urine therapy, and these people are who are openly accepting that there is something which modern science doesn't know. Now, having said this, I have not able to make few of the slides in English, but I will explain them. Having said about the traditional references, having said about what are the scientific basis towards urine therapy, having shared some of the case studies with you, now you all may be interested, or at least inquisitive, to know about its procedure. How is this urine therapy done? How we can do the urine therapy? So generally, the Amroli is done, the Amroli Kriya is done in 2 ways. One, it has the internal consumption and external application. The first one would be the internal consumption. So oral consumption. In oral consumption, it is called as a Shivambu Panam. So you drink the urine orally. So it has again 2-3 levels. Initially, the person who wants to begin this therapy or this practice would start just taking the urine in a smaller quantity and hold it in the mouth for some time. The people who have problem with the gums, the people who have problem with the teeth, they can just hold the urine in the mouth for some time, maybe 1 minute, 2 minutes, and then puke it out. This also has helped many people. So it is called as a gargling, or even the way they do the oil pulling. There is a one system called as oil pulling. They hold the oil in the mouth. Similarly, you can do the urine pulling. You can hold the urine in the mouth for some time, and that will help for oral issues. Then the main problem with the urine drinking is, first is the mental block, because since childhood we have been trained, we have a strong belief. It is told to us that urine is nonsense, urine is waste. It is, and drinking it again means you are doing something unnatural activity. So once that block is removed, once you are open to it, you consider, okay, this is something which is kind of a medicine. Let's try. So once that mental block is removed, still then there are two issues. One is its taste, and one is its smell. So a beginner, what he can do is, initially you can take a glass of water and put 1 or 2 spoons of urine in that and start with. Slowly. Or maybe somebody who is prepared can start half urine, half water. If you have to give it to some children, you can mix 1 or 2 spoons of honey in that, and that also could be consumed. So this is for beginners. But people who are mentally prepared, people who are in yoga, for them these issues won't matter. If it is told, yes, let's try. For them, we generally say the midstream urine is the best. So how do we collect the midstream urine? First part of the urine needs to be left out. Last part of the urine is also left out. Midstream urine is collected. So while collection itself, we collect it in such a way. But many times what happens? People leave out the first part, much of last part, and only they collect a small amount of urine. And they say, okay, I am drinking the urine. How much urine needs to be? Optimal dosage for urine is considered to be 150 to 200 ml. So minimum it needs to be about 200 ml of urine. But again, the test. Generally, the urine tests like it contains lots of salts, so it is little salty in its taste. So again, the taste of the urine and the smell of the urine is much dependent upon our food and the climate.
And how frequently?
Yeah. Urine drinking is the people who are healthy, who do not have any issues of health, they are asked to drink urine once in a day in the morning. You do it over a period of time, say for minimum, to have a good result of it, minimum we need to do it for 3 weeks. Minimum 3 weeks. There are people who follow it for a longer duration. Like for me, I have been drinking my own urine since age of when I was in 4th standard. My father made me to do it. I had no knowledge. Since my father told, I started. That time I was a very good student of yoga, of course now as well, but I used to practice it thoroughly. And even we used to drink with the nose. We used to put the nasal drops. We used to do all the netis, and like there will be a group of people, father will say, come and demonstrate. So that's how we used to do that in those days. But for a beginner, you can mix it with the water. In a smaller quantity you can start with, and as you go on, slowly you can increase the quantity. As I said, your diet, your food is the one which affects its taste. So the food needs to be sattvic. Sattvic means what? Sattvic means the food which is fresh, not old one. You have prepared it, kept in the fridge, and then you are using it, is considered, the stored food is considered as tamasic according to yoga. We are not going in more details of diet, maybe sometime later. But the food needs to be with the less spices and fresh one. Then second thing is about its smell. If you are regular with your day-to-day lifestyle, we have seen that your urine will not smell. Generally, the smell that we have about urine is from the toilet. We get that smell from the toilet. But actually, when you collect the urine in a clean vessel, generally in Damar Tantra, it says they have explained different vessels. Lord Shiva says you can use it in an earthen pot. You can use it in a skull. Even there is a reference of a skull. That's how it comes in Agori practices. But here it is said that even you can use a steel vessel, you can use a glass vessel. But ideally, copper vessel is considered to be ideal one for collection and drinking of urine. Again, there is a ritual which says that when you are collecting the urine, face towards the east, collect the urine. When you are drinking, there is a mantra that is given in Damar Tantra which says that you chant this mantra and take. Actually, what are these mantras? When we started this session with the mantra, why do we chant a mantra? It is only to prepare our mindset. So when you are drinking, if you have a very positive set of mind, so considering that this is the thing, this is a medicine for me and I am going to consume it for my higher spiritual development, whatever the objective that you have, you consume it with that open mind. So that is the way it is told. These are the dietetic and lifestyle modifications we need to do when we start with. So first is urine drinking and urine gargling. Some people use it for people who have problems with their teeth, problems with like foul breath, people who have problems with their gums and teeth. They can brush their teeth with just taking urine and brushing them. That has also miraculously helped many people. I will just come back to this later. The next application would be using urine internally in the eyes. Even in a traditional yoga, it is said that urine is very useful for vision. It destroys or it helps in many of the conditions related with the eyes. We all are familiar with eye exercises. We are familiar with the Trataka. Trataka, what is Trataka? Trataka is one of the Kriya, isn't it? Trataka is one of the Kriya. So similarly, Netra Prakshalana, it's called as, that is washing our own eyes with urine. So we get an eye cup, so you fill in the fresh urine, dip your eyes into it. That is also called as eye bathing. Your almost eye will be dipped into the urine. You open your eye, close, open, close, open, close. Do this for 20 times. Throughout that urine, again fill with the fresh urine, do it with the other eye. So when we are doing Trataka or when we are doing the eyeball movements, exercises, if you club this eye washing also, that will enhance your effects by many folds. People who have refractive errors, people who have cataract, glaucoma, even I have seen people with aging whose vision was deteriorated, they have found benefited by doing this. We have plenty of examples, particularly with the refractive error, because many youngsters come to us saying that I want to remove this spectacle, this number is slowly growing, what can I do? So with again Trataka, eye exercises and this eye washing with self urine is very useful. We had one lady, I want to share, in fact that was the experience we had in Prashanti as well. There was a lady who had whose intraorbital, means inside the eye, the pressure used to be very high, that it used to affect her whole system, and she used to become non-functional. She had to put specific drops, eye drops, almost every 3 hours, otherwise she cannot function. And she came to us, then we just shared this information. I said, okay, let's try this. And to our amazement, she was using that drops almost for every 3 hours. We stopped it slowly, and she, even the frequency of that usage of that particular drug, we could reduce it to almost once a day. So she had to only put that particular medicine once a day, and that rest of the time we managed with the urine drops. So even urine could be used as a drops or as a eye washing. Second technique is nasal drinking. In yoga, we have a technique called as a neti. So we do two types of neti generally. One is called as a jala neti, second is called as a sutra neti, and third is called as Shivambu neti or Shivambu or Nasyapan also it is called as, because there are two ways. Neti, when we call it as a neti, because when you are entering we are leaving the urine from one side, it comes out from the other, is called as neti. And when you ingest it, when you drink it from the nose, then it is called as a nasyapanam. So it is done in both ways. Particularly we have seen this is very useful with the patients who have illnesses related to the most of the diseases with the sensory organs, and even diseases related to the brain. We have seen very good results in epilepsy doing this. So because the olfactory lobe and the olfactory nerves will be soothed doing this. So very useful in many allergic conditions. People who have chronic rhinitis, allergic rhinitis, sinusitis, people with asthma, they have found good results. Even some youngsters come to us saying that I want to improve my memory. We have seen doing this has helped even to improve the memory. Even some people come to us saying that, oh, my smelling sensation has almost gone. So there are some people who get with this problem. This has been very well benefited when it was clubbed with other neti kriyas. We found good results. So nasal drinking, eye washing. Then there is one more technique which could be considered as a internal technique. So we are talking about the internal application of urine. First we saw the urine drinking. Second we saw about the eye washing. Third we saw the nasal drinking. And then another one is called as enema, or it is also called as a basti. Urine is also used for colon irrigation or cleansing of our lower bowels. Generally in modern practices for enema, they use lukewarm water, or even sometimes in modern medicine they use soap water. In Ayurveda we use various types of extracts, herbal extracts for enema. There are two types of enemas that are generally given. One is called as a cleansing enema or eliminative enema, and another is called as retention enema. In Ayurveda, we have what is called as a retention enema, wherein only small amount of urine is ingested per anus inside the bowels, and that is the person is asked to hold it, and that gets reabsorbed from the larger intestine or from the rectum, and that has certain effect. So that is done in Ayurveda, but in urine therapy we use enema for cleansing. So again we have done some experiments with this enema therapy. We have seen that generally about 500 ml of fresh urine is used for enemas. So there is a vessel wherein you can put the fresh urine, there will be a tube, and next to that tube you have to connect a catheter, generally a rubber catheter, the way we use it for jal neti, sutra neti, that is number 2 to 3 number catheter we use for sutra neti. For enemas we use 8 and 10 number catheter, a rubber catheter. So that is little oil is applied and then it is inserted through the anus deep inside. It could be inserted about 4 inch, 6 inch, even it could be inserted to the 9 inches. If it is inserted and then we open the valve and then all urine gets in, and then after that the person is asked to do certain stretching exercises and then person is asked to evacuate. That is the procedure of enema. But we tried a very interesting experiment which I want to share with you. We had one lady who had problem in her esophagus. She had an esophageal tumor, and because of that she was not able to swallow the food. Her food intake was reduced. Since she was from a very village area, the medical attention and medical treatment was not offered to her, and the situation got deteriorated to such a level that even it became difficult for her to even liquid also she was not able to swallow. Even her own saliva also she was not able to swallow. She had to all the time puke it out. Then at this condition she was taken to the hospital. Doctors said she had to undergo chemotherapy, radiation therapy. They were not able to afford that, and somebody told about this therapy. They came to us, and then we had a big problem. How can we do therapy to her? Because her urine output was also less because she had dehydration. She had almost dehydration. She was put on intravenous fluids, and at that point we did a very interesting experiment. What we did was she had a mother. What we did was we took a enema pot and we connected. Actually, instead of enema pot, we used a saline set. Saline is used for intravenous injections. So we cut open the saline set, we removed the saline water, we filled her own mother's urine in that, and where the needle is attached, we attached the rubber catheter. And we inserted that catheter deep into the intestinal tract, and we started giving her what is called as drip enema. The way we give the drip into the intravenous injections, similarly we gave her what is called as a drip enema. Since her body was dehydrated, all whatever that was we were sending inside was absorbed. And within a few days, almost about I believe 48 hours, we found that her urine flow started, because her body started. Not only we gave the urine, we gave water also through the enema, and within 48 hours we saw that her hydration was well. Her dehydration was very well managed. She started passing urine, and then we started giving her urine orally. So she was only used to hold it in the mouth for some time, and on almost I remember almost on 7th day of all of this process was going on. On 7th day we observed that she was able to drink her own urine, some water, with the spoon, little by little on 7th day. So these are the experiments which we have done using enema. So urine therapy could be used in a various ways. I am just sharing you how the urine therapy is used internally. So internally used as oral drinking, internally used for eye washing, for nasal drinking, or even neti, and it is used in the form of enemas, or it is also called as a basti. Externally, I will discuss to you about external application, and then I will come back to fasting. Externally, urine is also applied to the body. That is called as massage. Now, massage, there are various types of massage techniques that are familiar, that are practiced. Since this is associated with the Ayurveda, we use centri, means the massage that is going towards the heart. So the procedure that is used while doing the urine massage, we rub the hands towards the heart. That is external application. For this external application, the old or matured urine is used. Now, how do we make it old and matured? In Damar Tantra, it is said that you have to make your urine 1/4 of its quantity. So suppose we have a 1 liter of urine, you make 1/4 of its quantity by either by making it, boiling it, you reduce it to its concentration to 1/4 of its quantity, and that is asked for smearing and application on the external application. And that is very useful not only for skin elements, even for wound healing. It is very useful to strengthen our muscles. We have seen people who have weak muscles, who have less strength in the muscles, they have gained a great benefit from urine massages. In Damar Tantra says the person who does the urine massage continuously over a period of time, he would get the strength of an elephant. That's how it is explained there. But well, we do not want the strength of elephant, but at least whatever muscles that we have, let them be in a proper shape with a good strength and power. So that could be achieved by doing urine massage. We at our center, we have evolved different methods for maturing the urine. What we do is, and then it is again importantly, whatever we have been talking so far is about self urine. So my own urine is good for me. So we are talking about the using our own urine for our own therapy. So that's why it is called as auto urine therapy, and that's where it is Amroli. So here also you collect your own urine, and either you can boil it and reduce it, or there is a one more method called as you keep it in a black covered bottle and keep it in the sunlight. So it absorbs the sunlight and it gets more and more concentrated, and that urine also could be used. To do that, minimum we have to keep that urine in the sunlight for at least 8 days. So it needs to be 1 week old urine. Then the problem with this is the proteinaceous contents in the urine get converted into ammonia, and this old urine smells very sharp and sometimes foul. So what to do to that? So to avoid this, we use one more thing called as a camphor. Camphor, many of you know, generally used in any Indian temple when they worship. So karpur usko, that's what we say. So we just make a powder of that camphor. Suppose like now we are going to have a massage. That old urine, you just take it in a small vessel, mix it with the camphor, and that is smeared all over the body. You would not get a strong sharp smell. Generally we advise after having massage you must have a light sun bath if it is possible. So if it is possible to have sunbathing, that will give an additional benefit. So that is how the massage is done. We also mix certain oils as well. People who have hot constitution, or even whenever there is a climate is also hot, in those situations we mix sesame oil, that is til oil, sesame oil with urine as a lubricant agent. So urine quantity will be about 75%, 25% will be the sesame oil. And interestingly, since urea contains some of the minerals, the oil and urine gets mixed. So it doesn't stay separate, it gets mixed. Then in the climates where there is a cold, in cold climates we use the mustard oil. So we mix it with the mustard oil. And the people who have problems with the skin, we mix it with the neem oil. So these are the few, there is a list of herbs that is discussed in Damar Tantra, which we can study for ourselves. We are going to give you some handouts, some literature, and for further studies also you can study. I will recommend few of the books. Then for external application we have another thing called as urine packs and compresses. People who have skin problems, people who have a swelling, pain, on those areas we could apply the urine packs, and that is also of a great benefit. There are two types of things. One is called as a compress, wherein you multi-folded cotton cloth is dipped in the urine and kept. Again, urine needs to be generally it needs to be warm or hot. You just warm it and then you apply those compresses. It's very useful to manage pain. People with the painful conditions, this is found to be very useful. There are various packs, knee packs, chest pack, abdominal packs are also done, head packs are also done. So that way it is very useful. So this covers, we have talked about the external application. Finally, a very important technique which is very effective is the urine fasting. I will briefly talk about fasting and conclude today's session. Fasting is a very, very popular technique in Ayurveda. Ayurveda says Langhanam Parama Aushadham, means fasting is the ultimate medicine for any disease. And in naturopathy, in Ayurveda, even in yoga and in various religions, fasting is used for various reasons. In religion, fasting is used. There are many people, you would find fasting is being done in all the religions almost. Why do we do the fasting? What are our beliefs regarding fasting? let the body rest.
It can be also a very mental exercise.
It helps for us to calm down our mind. It soothes our mind. But many of the times we see the people get irritated when they are fasting, because they are not eating, and then all the time there is a hunger. And of course that happens when the person is not habituated, or the initial stages. But the person who has understood the intricacies of the fasting would see that if you are a spiritual practitioner, fasting makes us more calm, quiet, because our Vegas, the speed of our mind, is reduced. So fasting is done in a religion for slowing down of mind. Even in various religions, there are beliefs that if you do the fasting, your sin gets cleared up. So the quota of your sin will be lessened. Some religious beliefs there is that if you do the fasting, if you have any strong mental resolution, that gets fulfilled. Sankalpa reaches to its goal. So there are so many beliefs regarding that. But in Ayurveda, the fasting is done purely for therapeutic benefit. So here also we are talking regarding fasting for our therapeutic benefit. And when the fasting is done in a different ways in Ayurveda, in naturopathy as well. When it is done for a smaller duration, it is called as a short fasting. 1 to 3 days of fasting is called as a short fasting. 1 to 7 days of fasting is called as a medium fasting. And beyond 7 days, if somebody is doing, it is called as a long fasting. And if the fasting is done even beyond 21 days, it is called as a very long fasting. There are people who do this kind of fastings. And even in a naturopathy hospitals, we make people to do that. And that has a very fantastic results. Again, fasting is divided and classified based upon what kind of food you take along with fasting. So one is called as a dry fasting. In dry fasting, you do not eat anything, and even you do not drink anything. That is called as a dry fasting. But therapeutically, this kind of fasting is considered hazardous. It's harmful, so it shouldn't be done. Second type of fasting is called as a water fasting, wherein the person only consumes water and eats nothing, drinks nothing. The person stays only on water, plenty of water, but nothing else. That is called as a water fasting. There is one more type called as a liquid fasting. The person takes only food and water in a form which is like water, very liquid fasting. So they take juices, no stuff to be chewed, only thing which you can drink. So that kind of food is taken and done the fasting. There are various types of such a fasting. Liquid fasting, there are various types, there are various schools which they advocate different types of fasting. That is what is called as a detoxification programs. People make them to undergo various types of fasting. In that, there are types like people take only green juices. Only greens are taken, and only in a form of a liquid. They are consumed over a period of time. So for 6 days, you are only consuming the green juices, nothing else. There are some things where they use only roots. The beetroot or carrot, all those which are of roots type, their juices are taken and the fasting is done. There are different types for that. So first is dry fasting, water fasting, liquid fasting, and there is one more fasting called as mono diet fasting. Now what is this mono diet fasting? That is very popular in Ayurveda and very effectively used in management of various chronic diseases. And there we have what is called as a Dugdha Kalpa, Draksha Kalpa, Amra Kalpa. Dugdha Kalpa means the person only drinks milk and milk and milk for 15 days. Nothing else. You don't eat anything. You only eat or drink milk. That is the way it is done. So that is called Dugdha Kalpa. There is also called as a Takra Kalpa, wherein the person is kept only and only on buttermilk. There is also a technique called as Draksha Kalpa. The person is kept on grape juices. There is also called as a Kalpa called as Amra Kalpa. That means you are kept only and only on mangoes. I think everybody will be ready for this kind of fasting.
Last
But again, this is recommended in different diseases, and depending upon person's constitution, their duration, the dosages is all monitored. But very effective among them, and which could be widely applied without any risk, is called as Shivambu Kalpa. Shivambu Kalpa means drinking urine for over a period of time, only water and urine, water and urine, water and doing the fasting. We have been using this kalpa, this kind of fasting very effectively in the management of various diseases. Whatever the case studies I presented to you, we have plenty of case studies. In fact, all of them, in all of those cases, our success is because of this urine kalpa. Fasting gives us best results. In fact, the fasting, if you do it in the water itself, is very beneficial. But when you add with the urine, it's more easier, because you recycle your many of the nutrients, we recycle many of the minerals. So during fasting, you don't feel weak. The elimination is very effective. Digestive system gets very good effect with the urine fasting. And we have seen in the first 3 days of urine fasting, we almost see that our intestines get cleansed. After by 5th day of fasting, we have seen many of our glands start excreting, and we have seen the people. So doing urine fasting initially is not that easy. So many changes happen in the body. Our body generally, our digestive system works. Main work for our digestive system is to absorb the nutrients. But when you put our body into fasting, the digestive system starts the work of excretion, and our body starts releasing lots of toxins in the intestine, and that need to be cleansed. And for that, we need to use other therapies like enema and certain Shankha Prakshalana kind of eliminative Shodhana Chikitsa when we are doing fasting. So it needs to be monitored. And we have seen in first 3 days the intestinal cleansing. By 5th day, we see the glandular cleansing happens. The tongue becomes more clear. The liver starts dumping its toxins in the intestines. Now, many times people start vomiting at that time. With the vomiting, with the emesis, a lot of toxins are cleansed. And by 7th day of fasting, generally with the urine fasting, we have seen there are changes in the blood as well. We have seen the change in the blood count. We have done some scientific investigations, and we have seen these results. So formula that we have developed is based on your body weight, we recommend the fasting. So suppose somebody is weighing about 30 kgs. So for every 10 kgs, we recommend 1 day of fasting. So if somebody is 30 kgs, he needs to do 3 days of fasting. Somebody is 60 kgs, 6 days of fasting. 70 kgs, 7 days. This is a safe and simple method for doing fasting. So now this is recommended in various disorders. Suppose somebody is suffering from various diseases, chronic ailments, the fasting is recommended. Now you and me, who do not have major physical problem, who do not have major illness, and still we want to do the fasting, how can we do that? For that, we recommend 1 day of fasting. So people who are beginners with the urine therapy, they can start once in a day urine drinking. They are habituated to do it. They are managing their lifestyle. They have changed their diet, going well. Now you are habituated. Now you can go to the next level of doing fasting. So in 1 day, since morning 6 o'clock till evening 6 o'clock, you will be consuming at least 3-4 times or more than that urine. You will drink a lot of water, and allow, even during that time, if you are able to do urine massages, eye washing, all those kriyas along with that, and even doing the massage will enhance the effect of fasting. 1 day of fasting is sufficient to rejuvenate, to enhance our immunity. But some people who are habituated, again, if you get to know this technique of fasting, you can even do a longer fasting on your own.
I have a question. I understood that the fasting cleans your organs and everything, but the urine, I understood, comes with all the toxins out. So, but fasting is drink.
Yeah, during the fasting, again, in the fasting, we do not drink all the urine. During the fasting, we recommend to drink maximum urine, but generally in the night time, we also ask them to excrete the urine. So in the daytime, one is drinking the urine, and during the night time, we leave out the urine. And a lot of water is also taken, and the main detoxification happens through the bowels. So during the fasting, main detoxification happens to the bowels.
I also heard, but I don't know if it's true, that after a certain amount of hours, the urine becomes toxic.
Yeah. During fasting. You mean?
No, in general.
Hmm.
In general. So, because we are always talking about this method of fresh urine. So
Yeah.
when you say fresh, so how many hours?
Yeah. Generally minimum about 3 hours.
3 hours. What
Yeah.
happened with the urine after these 3 hours?
Yeah, there are some experiments people have done. Actually, what happens is either if there is a, again, because see, urine is being very dynamic in its constitution. Somebody's urine would have a proportion of contents different, and all that will depend upon the kind of food and the kind of lifestyle you had earlier. So suppose the content of glucose and the content of proteins are there in the urine, that gets converted when it gets exposed to the oxygen and the external environment. And sometimes there is a chance that it gets contaminated. That's why we say minimum 3 hours for oral consumption, internal application. And if it has to be used for external application, that needs to be properly preserved, kept in the sunlight, wrapped with the black cloth, kept properly, and then used for massage and external application. So,
I have one more question.
Yeah.
Sorry.
Yeah.
The person who's having a very bad diet, so Coca-Cola, junk food, and all this, what happened with you? Is the urine after the natural process is still a good thing to drink, or you won't recommend that?
no, generally, ideally, we would recommend the people who are having wrong food habits. We'll ask them to first change their food habits for a time, and then slowly switch on to the urine therapy, not immediately. Certainly they can do the urine therapy. We have some people actually who come to our center. They say, okay, until we are here in your center, we are going to follow the diet and we are going to do the therapy. We want to take the benefits of this therapy. We will follow that thing. Once we go back, don't tell us your all dietetic restrictions. We want to do all the things. So in that case we say, and then what they do is they come every time, every 3 months they come and they say, we have come for detox. We would use this therapy for detoxification. For what? To go and eat all that junk things, so that we will become fit to eat that. So there are people who do that. But that is not our goal. Our goal is all these therapies, even whatever the techniques that we are using in yoga, is not just mere getting our body fit. It is again for our better, higher journey. So obviously a person has to follow a right way of living. So that right way of diet, right way of living, balanced food, balanced lifestyle is also essential.
People who has long-term medication.
Yeah, this is again a very important question. People who are on medication, who are taking pharmaceutical medicines for a longer duration, and obviously the excess content of that particular medicine is excreted to the urine. And if you take again that urine, that dosage will be more. So can we take that medicine, or how can we do urine therapy with that? In that we'll have to see the person to person and which medicines they are taking. Particularly generally the people who are taking antibiotics, chemotherapeutic medicines, people who are on steroidal medicines or hormonal therapy, we do not recommend them to go for urine therapy. But there are some people who are taking, say for example, anti-hypertensive pill, which is of very minute amount once a day. Then what we recommend them is, after having a tablet, do not drink urine at least for 8 hours. And then after 8 hours, whatever the urine is coming, that doesn't contain that pharmaceutical ingredient, your urine will be more clearer, that can be consumed. So they have to leave out at least 8 hours of gap. So again, that will be from person to person. So I know this topic is something which is a very new, and this is going to have raise lots of questions inside us. But what I would request and suggest to all of you is that with the open mind, try it for yourself, or at least try it with somebody who is ready. Observe the results and then decide whether it is useful or not. Right? Any questions?
One more question. If sometimes someone has urine infection, unaware of it,
Yeah, then is it person?
dangerous?
Yes. Very interesting. Question is that if there is a urinary tract infection, somebody has an infection in the urinary tract and person do not know, or maybe sometimes there are people who are dormant with the urinary tract infection. Then if they consume the urine, what will happen to them? Actually, when even generally in 99% of the patients, you wouldn't have any bacteria in the urine, even the fresh urine. But in case of such a urinary tract infection, we have even made those people to drink their own urine. And interestingly, the people who had a chronic urinary tract infection, they had taken lots of antibiotics. Even then that infection was not going. For them, their own urine has worked as vaccine. Very interestingly, I have one medical doctor, Dr. Sari. He is one of the big doctor who runs a big medical laboratory, and he is a head of a blood bank in Bombay. And he had a small stone in the urinary tract. And he used to observe there is a pain in his abdomen, and then he went to his friend and he said, I have pain. And then they just went for ultrasound and they found that there is a stone. And then, being a doctor, he said, okay, what's there? We shall go for a lithotripsy. Just we'll put a probe inside and we will just break it open, and that will be extruded. Both of the doctors, very friends. Next day, the appointment was fixed. He underwent the surgery. But with that procedure, even though they were doctors with so much of aseptic precautions, there was an infection set in his urethral tract. He thought, okay, that is also common. That is not a big thing. He went for various antibiotics. Even then, he took one set of antibiotics. That was not going. They did the urine culture. They found the specific organism. Okay, this is the organism because of which this infection has happened. They tried various antibiotics on that. They found the sensitive antibiotic. They did another course of antibiotics. Still that infection is not going. That person, a hardcore medical doctor, got so much disgusted. Then he went to various types of, even he took the Botox, and that used to be very painful. With this all things, probably his immunity got reduced because of using so many antibiotics. He must have undergone so much of dosage of antibiotics, and he always had a very painful urination. And most of the times, whenever he went for urine examination, his urine examination was found to be having positive for bacilli. Means they were urinary tract infection. This person was brought to us, and he was a doctor. He was open. He said, on earth, whatever you tell me, I am ready to do. I want to get rid of this problem. I am no way bothered whether it is scientific, non-scientific, whatever it is. I want to get rid of this problem, because every time when you have to urinate, you have to suffer. And he was ready. He came, we gave him 10 days of treatment, and he consumed his own urine. His testimonies are there. He is on Facebook, and he recommends urine therapy. So, in that case, what might have happened is that urine works. There is a theory, in fact, in urine therapy, how urine therapy works. The people have put forward many hypothetical theories. One among them is the vaccination. Because what is coming in the urine is not an active bacteria. If it is active bacteria, once we consume it orally with our gastric juices, it gets deactivated. And that remnants that are there, our intestines knows it. Our second line, the first line of defense, they know it. How does the vaccine work? you know what is the theory behind vaccination? We take the polio vaccine and so many different types of shots we take. What are they? They are actually half dead bacilli put into our body, which are not capable of producing full blown disease, but they are treated in body as a foreign, as a bacterium, and then immediately our body immunity cells get training to fight against them, and that is memorized, and that is called as acquired memory, acquired immunity. And that's how all vaccines work. So sometimes the antibodies found in the urine are found to be having a vaccine like inoculation like effect. So one can consume. Another question generally comes is how much gap needs to be given between food intake and urine intake. So if we had taken urine in the early morning at empty stomach, maybe at least 1 hour of gap needs to be given for any food consumption. So after having a urine, at least 1 hour of gap needs to be given. Then again some questions, the common questions since I am often I get whether the females during their menstruation whether they can take. No, during the menstrual flow, until the urine is not clear, they should avoid urine intake. Yes.
How effective it is in case of fungal infection of the eye?
Fungal infection.
Let's say somebody
Okay.
will give you almost like a plan.
Yes. I feel the first sample of the urine. Of course, if you people who practice the urine therapy, they observe over a period of time that the first sample of the urine in the morning is more effective, more beneficial, more medicinal. Second, third, fourth sample of the urine is more diluted. It contains a lot of water instead of the ingredients. So the first sample of the urine, because for eye washing, more it is concentrated, more it is initially irritating to the eye. So when we do, you get little burning sensation in the eye. If the person is ready to, it is only for few seconds or few minutes it happens, and later on your eyeball gets adapted. Little there will be reddening of the eye when we do the first sample of the urine. But in this case, which you are sharing, that the fungal infection, I think the first sample urine, eye washing will be very useful.
What are the chances that it can become normal?
I feel 90%. But again, we have to see what infection it is. If you can let us know what exactly and how exactly is the infection, that will be. Again, sunbathing, we have to find out the ways how we can expose the eye to the sunlight without directly exposing it to the sunlight, but still exposing to the. So which part of the area eye is affected by the fungal infection? Where is the fungal colony? We need to find out, and then accordingly we can. So sunlight and urine bathing, eye bathing will be very useful in that case. Yeah. So with this, we shall conclude today's topic on a very interesting technique called as Amroli auto urine therapy. Maybe some of you might be. How many of you were familiar to this therapy before? At least had heard about it? Yes, there are many people who had heard, but we have always some beliefs, some notions about it. With this understanding we have shared, hope those beliefs at least have gone, or maybe we are ready and open to understand it more. People who are interested, on Google, if you give urine therapy, there you will get plenty of pages. But people who are really interested to know about it, I would recommend 3 books. One, written by J.W. Armstrong, which I had told you already. We have flashed the slide there, called Water of Life. Second book is by Martha Christie. Your Own Perfect Medicine. This is very good, very nicely written book, and with a scientific perspective. And there is one more book that is written by a Dutch author, Kroon Vander Kroon. He is a very good friend of mine, and it is labeled as Golden Fountain. So these 3 books, people who want to study this therapy, for beginners, I think material is there on the internet, but who really wants to study this therapy, want to know more about it, these 3 books will be very useful. Go through it. There are plenty of testimonies that are also available. I think.
Can you repeat the last one?
Golden Fountain by Kroon, Kroon. Koen Vander Kroon. His name is like that, but Kroon, Kroon, would be sufficient. Haji.
Okay, thank you very much. Okay. What I am thinking, I am going to his ashram in January, maybe somewhere in mid-January to detox. I will try it. So maybe that's the best way. If you are coming India, other day, you can keep in touch with him, take the email ID. Okay. When we visit it, first time to start in their guidance will be good